Okay, so now that I've finished the insertion, of course I would have washed my hands, took my gloves off, all that good stuff. Now that I'm going to take it out, I would put some gloves back on. We're good. I performed hand hygiene before this. I'm going to remove the tape from her nose. Ooh, this tape does not want to come off. Okay. Holy moly, get off. I would also detach it from her gown. And I'm going to instruct the patient to hold her breath. And while she does that, I'm going to withdraw the tube and controlling it so that we don't splash around all the gastric content as we're taking it out. Okay, so I'm going to go ahead and dispose of this. I will inspect to see if there's anything going on with the nose, and I would have inspected the tubing as well. I'm going to discard everything in the trash and the right receptacle and all that kind of stuff. I'm going to remove and discard my gloves and place in the trash. I'll perform hand hygiene. And I will reassess to see if Miss Jones needs anything. If she does have any pain afterwards, I would accommodate to that. I will also put the side rails up, put the bed in the lowest position, bed locked, call light and reach, and then I would perform hand hygiene. And then it goes on to documentation. So we'll make sure I'm documenting on the right person and the type and size of the tube that I inserted, so it would have been a Salem slump. And I would talk about the technique I used and if Miss Jones had any adverse effects to it, to see if she had, I would assess what I found with the gastrointestinal and the respiratory assessment, nasal and oral hygiene. I would then signature and initial.